A 56-year-old woman is referred to the physician office for mammography results with the uh, results that shows dense speculated mass with clustered microcalcification. A family history is negative for breast, endometrial, and ovarian cancer. She is a former flight attendant. Since retirement, she has started a strict Mediterranean diet because she was trying to compensate for lack of physical activity. She is a mother of two, breastfed each infant for 18 months as recommended by previous physician. Her only two surgical procedures have been breast augmentation with the implants and tubal ligation. The physical examination is unremarkable and there is no palpable mass, no nipple or breast skin abnormality. Which of the following is the most significant risk factor for development of breast cancer in this patient? It's a occupation of her that led her to have a breast cancer. Anyone know the reasoning behind it? We'll discuss this question, but it's a very new concept. Yes, the patient was sleep deprived and it affects the melatonin. So melatonin is a regulator for some cancer. It's a antioxidant which helps to decrease the cancer risk. So this patient was having who was a former flight attendant. She was having certain risk of working overnight, like what other professions like nighttime nurses who works overnight. So they have decreased production of melatonin and that causes them to have decreased antioxidant property and this leads them to have a certain type of cancer. Okay. Yes. So sedimentation is like patient lack of physical activity doesn't really play a role in development of any breast cancer. It plays a role mostly in some of cardiac disease or also osteoporosis. That's osteoarthritis, osteoporosis. And breastfeeding is actually decreases the risk of having a breast cancer. Mediterranean diet is not linked to any type of cancer or the breast implants is have very little risk to no risk. It usually causes inflammatory breast cancer, which is usually seen as red erythematous breast mass. So patient is having occupation related cancer. So you can see occupation related cancer in airline cabin attendants and nurses tend to be associated with recognized risk factor, that is having to work night shift after midnight, and this increased risk is related to impaired melatonin production as a consequence of nocturnal light exposure. So what are the other risk factor we have to remember for this breast cancer? Certain risk factor we have to remember is some of them are modifiable, which means it can be changed by patients right currently to decrease the risk of getting breast cancer. One of them is hormonal replacement therapy. If patient is taking any estrogen therapy after the having menopause, they are increased risk of having breast cancer. Nulliparity, having no children, is also risk factor for having breast cancer, because there is a more exposure to estrogen, and the estrogen causes in the breast cancer. The increased age at the first live birth, which is increased risk of having breast cancer. Increase in alcohol consumption, that is linked to the increased breast cancer. What is non-modifiable? Non-modifiable is which cannot be changed by the patient. Either they are born with it, or the age related, or the family history. So the family history of having genetic mutation or the breast cancer in first degree relatives is a risk factor. Having white race, they are the people who are born in white race or Caucasian race, they are increased risk of having breast cancer. Breast cancer increases with the age, and if the patient has early menarche and late menopause, which again increases the estrogen exposure on the breast and causes breast cancer. Certain family cancer, certain family syndromes, they are linked to having increased breast cancer. One of them is Lynch syndrome. Lynch syndrome is usually associated with colorectal, endometrial, and ovarian cancer, and BRCA1 and BRCA2 is associated with breast cancer and ovarian cancer. Here is certain how melatonin is produced and what does it play important role in circadian rhythm. The suprachiasmatic nucleus, which is in hypothalamus, regulates the circadian rhythm by processing the light information from the retina and modulate the body temperature and production of certain hormones like cortisol and melatonin. The dysynchrony between the local environment or the patient's daylight hours or sleep schedule and the internal circadian rhythm causes them to have insomnia and daytime sleepiness, which is experienced in jet lag passengers. So how can we treat circadian rhythm or dysynchrony in circadian rhythm? We give them melatonin supplementation to treat their insomnia and their jet lag.
Thanks for watching. Please give a thumbs up and subscribe for more.